part two. I'm sorry, we got a little cut off. I just had a couple more things I was going to touch on. Currently, within the last 4 years or so, I was put on blood pressure medication as well as acid reflux medication. About 4 years ago, I was working a really stressful job, and I think that's a lot of the reason. I've always been big, so it's not been really a weight issue so much. But a lot of people complain about acid reflux with the sleeve versus the bypass and things. Based off of what I've spoken with my surgeon about, it sounds like your risks are kind of similar with things like that. But I stand a 50% chance of being off that medication completely, which I'm really excited about. Also, he went over all the, the not so fun things about the percentages of something happening, you having a clot, a leak, something like that. With the sleeve, the risks, though all risks are low completely. For example, like a risk for maybe like a clot would be 1.5%. With sleeve, they go up to almost 4% with bypass. So though percentages continue to stay low, they're even lower with the sleeve. So it is a less invasive surgery. So that's definitely something to take in consideration. I mean, we all want this to happen. We all want this to be successful. And for the most part, a lot of that is on us. Cutting out those things that really don't make our lives any better. I mean, I drink diet soda like crazy, and it's probably not doing really good things to me at this point. So giving that up, I mean, it'll be hard, but I think it'll better my life in the end to do so. So things that we're going to be giving up are really not that terrible. There's a couple more things. So like alcohol, can't have alcohol for a whole year after surgery. So keep that in mind. Myself, I'm mostly a social drinker. So that will affect a little bit of my social gatherings and such, but not something that I can't give up for a whole year. Obviously, with the size of your stomach, you're not going to ever be drinking crazy again anyways. They do recommend cutting out caffeine. So if you're a coffee drinker, I am not, but they talk about switching to decaf. I think that honestly are the big major points. Like I said, next week I don't have anything set up, but the following week I have my EKG and blood work with my doctor. I have my first dietary appointment, and then I have that biopsy. I did speak with a psychologist that I'm going to have my appointment with. Chances are ended up getting scheduled that week as well. So that's going to be a big week for me. So I'll be definitely posting a lot. If anybody watching this has any commentary as well, like creative criticism is always welcome. This is not something I regularly do, but like I said, I think it's important to let people know that there are options, and that they can change their life if that's what they want to do. Either way, thanks for watching.